Hi, this is Dr. Robert Antolak from theGentleDentist.com in Shelby Township, Michigan. Our office phone number is 586-247-3500. And today I would like to just discuss a simple process that is amazing in how it helps children prevent cavities. Cavities first form usually on kids as long as they have good nutrition. If they take place is on the first molar teeth. So the first molar teeth, if this is a lower jaw here, the first molars are the first ones as we look back. Okay, and on these first molar teeth, because they're the first ones that come in around 6 years old, they're in more of the cavity-prone ages. The cavity-prone ages are the first come in, and if kids have a nutrition on refined carbohydrates such as sugars that come from like fruit roll-ups and sometimes juices and pop and candy and things like that, which is in so many foods. But as the stuff sits down in the deep grooves of the teeth, they can start to get cavities. And the best way of doing that is to actually seal off the area. So what I did is I drew, this is what a cross-section of a tooth would look like right here. This would show absolutely what like a molar tooth would look like. And in the grooves of where the teeth are, so this part here is the enamel part of the tooth. That's the white part of the tooth that we can see right here. All right, and then as food and particles start forming down in the deep grooves of the teeth, like in this region here, cavities start forming because it gets real. Sometimes it gets so thin and narrow that not even the width of a toothbrush bristle will fit down there. But bacteria in the right environment can actually sneak down into these deeper areas and start forming cavities. These are where the cavities first start forming. So a cavity will form in here, and then what happens is it gets down to what's called the dentin. This is the dentin layer. Inside of the dentin we have what's called a pulp, which is where the nerve is contained within the tooth. And so when cavities form in the enamel layer, the hard part, it forms like this, and then it starts to form like this as the cavities start getting bigger and bigger and bigger. And so then it can get into the nerve of the tooth like this, and then you have problems such as needing root canals and things like that. So rather than waiting until it's too late for that, we will do what are called dental sealants. A dental sealant is, rather than keeping this the way it is here within the enamel, we will apply a material, and what that material does is it will fill in this space right in here, so that now, rather than having the deep groove, you have a sealant that will cover that deep groove. And now, if it's well bonded in place, now when you brush your teeth, it's all very cleansable that way. Okay? And so what we do with that is we prepare the tooth structure itself. We use an acid etch that actually makes it kind of porous. And then we use, with this very little thing here, we put a bonding agent in that helps to secure it to the tooth, and then we flow the material into the deep grooves like this. Okay, then we use a light that's like a purple light that will harden the material. It only takes about 5 seconds or so, maybe 10 seconds for that light to harden the material. This thin composite material, which is called composite, it's I'll just squirt a little bit out of my hand here, and as you see, it's white. And so it blends in with the teeth, and it also bonds right onto the tooth structure. So now, rather than brushing teeth with the grooves in it, it's nice and smooth, and it's a great way of taking care of cavities. The key of this is making sure that the understructure, when it's first done and bonded, it's very clean. What can happen is plaque can develop in this area, which is bacteria, preventing a good, strong, secure bond. And so if that takes place, that will fail. What we do at our office is we make sure that deep surface is very clean so it can be bonded to, and we can have an assurance to know that your children can have teeth that will last them a lifetime. And if we do something like this, at least the biting surfaces during those cavity-prone years will be effectively sealed and prevent them from having any further problems. And as far as sealants go, what we do is sometimes we'll even go up to the bicuspid teeth. So sometimes we'll do 4 teeth on each arch 4 teeth here and 4 teeth here, and on top the same thing. So there's a total of possibly 16 teeth that could be bonded in place. Once again, it's very conservative. There's no numbing necessary. It's done before any cavities form, but it's ensuring the fact that these teeth can last a lifetime. So if there's any interest of that, which there should be, then you can contact us at thegeneraldentist.com, or our phone number is 586-247-3500, and happy smiling.